Okay, thank you for joining us, and we will start right away with Dr. Afnan Al-Ghanmi. Thank you very much. I really like your credibility. Inshallah, in less than 2 years, you will be an official doctor academic. From Tufts University, Dr. Afnan will be discussing a special event on Jordan Nutrition Innovation Lab Research Spotlight, and I'll leave it up here to tell us what is special about this special event.
Hi everyone, and welcome back. Thank you for joining us. We're thrilled to have you in our second day of the Symposium. So this indeed is a special event, session that we are highlighting presentations from 2 Jordanian-based researchers, fellows supported by USAID-supported the JNIL project. The annual JNIL fellowship initiative from the JNIL project is aimed to enhancing supporting the capacity of Jordan-based research professionals to perform policy-relevant research on maternal and child nutrition and health innovation. So please join me in welcoming to the stage Dr. Marah, Hailat, and Dr. Nahla Al-Bayyari. We will be starting this session with Dr. Hailat presenting to us. Dr. Hailat is a general physician. She is also a research fellow at the Jordanian Nutrition Innovation Lab. She has previously worked as an intern doctor at the Jordanian Royal Medical Services. She has also worked as a researcher and a research assistant in studies focusing on gestational tumors and maternal health and COVID-19. So she will be presenting to us an assessment of factors associated with neural tube defects during COVID-19. Please.
Thank you, Afnan, for the introduction. Hello, everyone. Good afternoon. I'm very pleased to talk to you today about my presentation as a JNIL research fellow. My presentation is entitled Untitled Chapter Associated with Neural Tube Effects During COVID-19 Pandemic, Results from Multimedia Intensive Care Units in Northern Jordan. Okay. Neural tubes are a group of birth defects which result from the incomplete closure of the neural tube during the early stages of embryonic development. Annually, over 300,000 babies are born with neural tube defects all over the world. However, the prevalence of the disease in low-income countries is yet still not clear. In Jordan, prior to COVID-19, and according to Dr. Al-Hasan's study, the prevalence of neural tube defects was 1.4 per 1,000 births. As we all know, inadequate levels of folate and vitamin B12 during pregnancy has always been linked to having an increased risk of neural tube defects. However, around 70% of cases decreased when folic acid supplementation and fortification programs were implemented. 30% of cases are not folate dependent and are due to other causes. One of the attributable risks for neural tube defects is having BMI equal to or higher than 29. During the COVID-19 pandemic, about 68.5% of Jordanian women became obese. So this would mean that the risk for neural tube defects is expected to increase. Antenatal care visits also dropped by 38.6% globally, and so this would also mean that neural tube defects prevention and screening is expected to decrease. Back in 2002, the Jordanian government introduced a fortification program for wheat flour with iron and folic acid, and in 2004, the Jordanian government implemented the folic acid supplementation in antenatal care centers. However, while I was doing my internship here, I noticed that the levels. I noticed that there were high numbers of neural tube defects admissions into the neonatal intensive care unit. So this made me think that we should screen and identify variables that are associated with neural tube defects to modify the situation. And so hopefully obtaining the results will help the government reconsider all the programs and services provided for pregnant mothers, and consequently this will decrease the burden of disabilities and the fetal and neonatal mortality rates. The aims and objectives for my study were to investigate the effects of the COVID-19 pandemic on the prevalence of neural tubes, to study different factors associated with higher risks of neural tube defects, and to identify the most significant factors attributable to increasing the risks of neural tube defects. My research hypothesis was whether the COVID-19 pandemic increased the risks of neural tube defects due to the decline in antenatal care visits that happened during the pandemic, and if the weight gain that happened during the lockdown also helped in increasing the risks for neural tube defects. My study is a cross-sectional study. I recently started collecting data. I recently obtained my IRB from the Jordanian Ministry of Health and King Abdullah University Hospital. I'm still waiting for my IRB approval from the Jordanian Royal Medical Services. My target population will be all the babies who were born with neural tube defects during the period of December 2020 and August 2022, who were born in the north of Jordan in 12 different hospitals. So all the babies that were born before the pandemic or without history of neural tube defects will be excluded from my study. So basically what I'm doing right now is that I go to the hospitals that I selected. I review the past medical records, and while reviewing the past medical records, I also gather the contact information of the parents of the babies who were born with neural tube defects. And I gather their contact information so that I can fill out the questionnaire with them. All the parents who agree to participate in the research are asked to sign a consent form before I fill out the questionnaire with them. And well, the questionnaire that I'm using was reviewed by a panel of neonatologists and nutrition specialists to ensure its validity, and I conducted a pilot study of 15 participants to ensure its reliability before I created its final form. The questionnaire consists of questions regarding socio-demographic, medical, antenatal, and nutritional aspects. As I said earlier, my aim is to collect data from all the babies that were born with neural tube defects in northern Jordan between the period of December 2020 and August 2022. So when I wanted to calculate the sample size, I relied on the prevalence of neural tube defects that was mentioned by Dr. Al-Bayyari in his study. It was 1.4 per 1,000 births. And I also relied on the number of live births in 2020 that was reported by the Jordanian Department of Statistics, which was 54,565 births. And so the estimated number of cases in my study is expected to be around 76 babies. After all data is collected, it will be coded and entered into a Microsoft Excel spreadsheet, and I will analyze the data using the SPSS statistical package version 25. In my study, there is no conflict of interest. Hopefully, this research will contribute to the overall JNIL research agenda on maternal, infant, and young child nutrition in Jordan by helping in decreasing the burden of disabilities and the fetal and neonatal mortality rates associated with neural tube defects once I obtain my results. I would like to thank the Jordan Nutrition Innovation Lab and the USAID for giving me this opportunity to work as a research fellow with them and to conduct this study. I would personally also like to thank my mentor, Dr. Al-Bayyari, from Qatar University, who unfortunately couldn't be here today, for her guidance throughout this journey. And thank you all for listening.
Thank you, Dr. Marah, for sharing this with us. This is very interesting study. We'll look to see the results of that. Now, I'm happy to introduce to you Dr. Nahla Al-Bayyari. Dr. Al-Bayyari is Associate Professor and Researcher of Human Nutrition and Dietetics in Balqa Applied University, faculty of Al-Hasan University College, Department of Nutrition and Food Technologies. She's also a research fellow at the JNIL project, and Dr. Al-Bayyari has supervised and examined several human nutrition and dietetic master students. She has published numerous articles in scientific journals and served as a tutorial board member and reviewed several peer-reviewed journals. Please welcome Dr. Nahla to the stage.
Thank you, Dr. Afnan. Good evening, everybody. It's my pleasure to participate and talk about my proposed JNIL research project, which is entitled Dietary Diversity, Gestational Weight Gain, and Iron Deficiency Anemia of Mothers Attending Antenatal Clinics in Northern Jordan. First of all, this kind of research is done and written by me, and there is no conflict of interest regarding this research project with any researchers. I will just give you a brief research background and talking about the research aims, hypotheses, expected outcome, methodology, the policy and program implications, the acknowledgement, and finally get to see a list of references I used in writing this research proposal. We know that we are focusing on pregnant mothers to gain the normal weight range because it is associated with the healthy outcome, which is a healthy baby. And this will help avoiding the maternal mothers to become overweight after pregnancy. Also, this reduces the risk of chronic diseases for both the mother and the child. Most of women with insufficient weight gain usually have poor dietary diversity, and their intakes of energy, vitamins, minerals, usually it is very low. As I said in my talk titled, I will study the iron deficiency anemia, and we will focus in this research on gestational weight gain and iron, because as we know, the iron needs increases during pregnancy to meet the demands for the fetal and the maternal needs. Unfortunately, Jordan has no progress toward achieving the target of reducing anemia, and 99% of pregnant mothers have low adherence to dietary guidelines. This, by overall, gonna lead to low dietary diversity scores and increasing the prevalence of more weight gain during pregnancy. And the research in general showed that this is going to increase the prevalence of infant and maternal mortality and morbidity. Sorry. Yeah. My research aimed, first of all, to assess dietary intake, hemoglobin and iron status and weight gain of pregnant mothers who will be attending the antenatal care clinics in the north of Jordan. The second aim to identify the various factors associated with low food consumption and not achieving the minimum dietary diversity or access to nutritious food during pregnancy. The third aim to study the impact of dietary diversity scores on gestational weight gain and iron status. Also, we will estimate the prevalence of iron deficiency anemia among the study population, and we will determine the rate of compliance with iron supplementation. Finally, we will assess the pregnant mother's dietary knowledge, attitudes, and practices during pregnancy. My research hypothesis, I hypothesized that women did not eat the variety of foods, not stick with the iron supplementation, and not attending the antenatal clinics will experience abnormal weight gain during pregnancy and are more likely to develop iron deficiency anemia. We expected from the results of this research to reconsider many health, nutrition, and economic policies that address the problems related to the health and the nutrition of pregnant mothers. The study design is cross-sectional, and I would like to announce from this stage that we started the data collection in the previous week, okay, after we getting the IRB approval from the Ministry of Health. So we will conduct the cross-sectional study on pregnant mothers who attending the antenatal clinics in the north of Jordan. The mothers should be singleton pregnant mothers aged between 19 to 45 years and attending only the MOH antenatal clinics in the north of Jordan. And we will exclude the women diagnosed with gestational diabetes, preeclampsia, chronic diseases such as diabetes, renal diseases, liver diseases, autoimmune disorders, and those women suffering from hyperemesis gravidarum or the severe nausea and vomiting, and those women with unrecorded pre-pregnancy weight before entering the pregnancy. Each participated women agreed to participate in the study should sign a consent form. We calculated the sample size based on the prevalence of low birth weight newborns, which it was 13.8% in Jordan, according to Islam et al. In 2020. The estimated sample size was 183, and we will increase the sample size by 10% to increase the power of analysis and to compensate for the losses or for the cases we will not able to include in the data analysis. The selected pregnant mothers will be categorized into 3 groups according to gestational age. First trimester group from 0 to 13, and the second trimester from 14 to 26, and the third trimester from 27 to 40, and each group should include at least 60 pregnant mothers. We will use different methods to collect the data. First of all, we will use a structured and valid questionnaire to collect the socio-demographic, health and medical history, nutritional knowledge, as well as the pattern of antenatal care, while the attitudes, practices, and knowledge of the participants, we will use the CAP model adopted from FAO by 2021. Also, we will collect anthropometric data, including weight, height, to calculate the BMI, as well as we will assess the participants' physical activity duration and intensity using a semi-quantitative pregnant physical activity questionnaire. As well as we will collect some blood samples from the participants to analyze the CBC and the serum ferritin level to identify the iron level of the participants and if they are diagnosed with iron deficiency anemia or not. As well as we will collect dietary data using the 24-hour recall to calculate the minimum dietary diversity score for women and a validated Arabic language for food frequency questionnaire to calculate the prime diet quality score. The proposed research as a policy and program implication expected to provide baseline data regarding the dietary intake of pregnant mothers and their compliance with the iron supplementation and the impact on the gestational weight gain and pregnancy outcomes. Also, the findings of this proposed study could encourage the antenatal care clinics to put more effort on pre- and post-conception nutritional education of future mothers, as well as it might motivate mothers to comply with the antenatal visits and iron supplementation. Finally, I would like to thank and acknowledge the Jordan Nutrition Innovation Lab and Tufts University for sponsoring this research and the USAID for their financial support, and Dr. Halima Sabbah from Zayed University for helping and mentoring this research. Thank you all for good listening, and be alerting with me after lunchtime, sorry, okay? Yeah, because we have all of us hypoglycemia now. Yeah, we can't concentrate well. Thank you all.
Thank you, Dr. Al-Bayyari. Now we open the session for Q&A. And just a friendly reminder for our Zoom participants to post your questions in the Q&A session, and we'll have them ready for us. Any question in the room to start with? Yeah, can we get the mic to Dr. Afnan, please?
Yeah, thank you for presentation. In terms for the neurotube defect, do you have an idea in terms of what's their underlying cause for this high rates of neurotube defects?
Right now, you mean during, like after the pandemic?
Yeah, I mean, why you think these neurotube defects, what is the underlying cause for it?
So I think that due to the lockdown that happened because of the COVID pandemic, a lot of women didn't have access to antenatal care. So this would mean that they didn't take folic acid supplementation because they didn't visit the antenatal care clinic. So this is actually my hypothesis. This is my study hypothesis, whether the COVID-19 lockdown increased the neural tube defects cases because of the drop that happened in antenatal care visits.
Any other questions in the room? Great. So just to kind of reiterate Dr. Kaplan's question, do you think that just the supplementation would be the only reason, or do you think that the...
No, there's also, okay, now I understand. No, it's not just the folic acid supplementation. During the lockdown, there are a lot of studies that showed that pregnant women had, their nutritional habits, they were different because of the lockdown. They didn't have, they can't access all types of food, and so this also might have increased their chances of developing folate deficiency. And also because of the reported obesity during the lockdown, that maybe this has increased the cases of neural tube, because it's also a well-known fact that the BMI of 29 or higher is also associated with increasing the risk for neural tube defects.
Great, yeah. Dr. Asma, please.
Good evening. I can add other causes for this is the increased incidence of unplanned pregnancy, and there was no accessibility for contraception at that time.
Yeah, thank you for adding that. Great.
Might be.
Any other questions? All right, so I might ask Dr. Nahla actually a question regarding
Yes, of course.
the anthropometric, and just because I'm a dietitian, so I'm kind of like picky in these things. So were you trying to indicate that you're taking a BMI and weight and height for the pregnant women? So are you going to take that pre-pregnancy or during the pregnancy?
We will follow anything recorded, okay, in the pregnant mother medical records. If there is previous weight records, yeah, we will take it in our study. But actually, we will consider the pre-pregnancy weight to know the pre-pregnancy BMI, and then to see if the women increasing the gestation according to her gestational age, the right weight gain, or if she is underweight or obese, or there is extra weight during pregnancy. And I hope that I can follow up those women after they deliver. We have the expected date of delivery, so I am planning to call them, okay, after they pregnant, to see the weight and height of their infants.
Oh, okay.
Yeah, this is one of the plans. Yeah, I'm looking forward to do it. Yeah.
Great. Thank you so much.
You're
If you don't have any other questions, I'll just hand it to Hannah, and thank you so much. Thank you.
Okay, thank you.
Thank you.
Thank you, Dr. Afnan, and best of luck to Dr. Marah and Dr. Nahla in your researches. That was indeed great moderation, Dr. Afnan, as usual.